Welcome to Body Sculpt of New York 6 Weeks to Fitness podcast, where we hope to inform, motivate, encourage, and inspire you towards living a healthier lifestyle. And now, here's your host, the president of Body Sculpt of New York, Vince Ferguson.
Welcome to another episode of 6 Weeks to Fitness. My next guest is Becca Rose, the owner of Myofunctional Pathways, LLC. She is a myofunctional therapist, certified Butayko breathing instructor, sleep coach, and registered dental hygienist. Today, she's going to share with us how proper breathing techniques can enhance our performance and strengthen recovery for faster results. Did you know that proper positioning of our tongue and nasal breathing can improve our respiratory issues such as asthma and COPD, as well as other issues such as fibromyalgia, menopause, migraines, high blood pressure, ADHD, and so much more? Now, if you didn't know this, well, guess what? Neither did I. Becca also has an 8-week performance and recovery program. I think you're going to really get a lot from this interview, and I know for sure that I did. Becca Rose, welcome to 6 Weeks to Fitness, episode 213. Thank you so much for joining me today.
Thank you for having me very much.
Well, it's my pleasure, and as you know, I interviewed a colleague of yours, Carice Laguerre, also a myofunctional therapist, and the information she shared was just mind-blowing. So I'm really looking forward to speaking with you, especially when it comes to how breath work and proper use of the tongue can add to your fitness and your performance. This is so important because this is a health and fitness podcast. So I want to see how we can just tie that all in. But before we do that, tell my viewers and my listeners more about Becca Rose. Where did you grow up? What was your childhood like? And what brought you to become a myofunctional therapist?
Oh my goodness. Okay. So yeah, my name is Becca Rose. I have been in the dental field since 2004. Like Carice, I'm also a hygienist. And then I got interested in the myofunctional world when I went to a conference. And I'm like, wow, a lot of these things really are relating to my life and my struggles. So I live in Wisconsin. I've been here for 20 years, but I actually grew up in Northwestern Connecticut, so not too far from where you are. Yes. So I grew up there, but I was the kid who had so many allergies, and I was just miserable and sneezing and the runny nose. And you know, back then kids didn't take allergy medicine the same way we do now, right? So we just kind of suffered.
Yes.
And it was miserable, and I suffered and suffered. And as I got older and older, that started to have an impact on my health. I was having tons of strep throat and tonsillitis and sinus infections, and it led to having my tonsils out when I was 28 years old, and that was not pleasant. And then about 5 years ago, I had sinus surgery because just a lifetime of the inflammation and the improper breathing finally took its toll, and I was not able to use my nose anymore. And even after I had my surgery, then the doctors didn't tell me, you know, breathe through your nose, breathe through your nose. It wasn't until I started learning about the myofunctional therapy in the airway component. So we're very airway focused. That really kind of triggered my interest. And then I went from there and did some of the breath work training and things. So here we are. And I've been in myofunctional therapy for about 3 years now.
Oh, 3 years.
Yeah.
And I noticed it seems like most myofunctional therapists, their previous lives were spent as dental hygienists. Is that correct?
A lot of us, yeah. Any profession that has a high degree of education in the head and neck anatomy can go on to do myofunctional studies. That includes like a speech and language pathologist, doctors, nurses, dentists, chiropractors. So just anyone who has a lot of knowledge in that head and neck region can go on and get myofunctional therapy training. So yeah, a lot of us are in the dental world.
Yeah, I see that. I'm very impressed. As I dive in, do my research, I'm finding out that a lot of dental hygienists, they take that next step, you know?
Yeah.
But you're right, though. I don't hear many doctors talking about nasal breathing. So it's quite interesting that this is what you guys do. And you had it was a personal experience for you. That's the allergies and the sinus issues you had that brought you to this point, to this step. But which is also very good because you can speak from experience as far as what it can do. And that's important. Okay. Now today, again, I want to discuss how myofunctional training can improve, increase, or even enhance our levels of fitness. Because as you know, 6 weeks to fitness, I want to make sure that my viewers, my listeners know how proper breathing can help them. And it's so important because so many of us are not breathing properly. And again, speaking of personal experience, not knowing that you should breathe in through your nose and even out through your nose.
Yes, especially out through your nose.
And I had no clue, as long as I've been on this planet, Becca, and I've been on the planet for a while, let me tell you. Okay, and I never heard this, in all my military training, physical training, whatever it is, no one talked about that. They just said, breathe, just breathe. But I found by breathing in through my nose and out through my nose, I had more energy. But let's talk about this. I know also you have a program. It's an 8-week performance and recovery program, right?
Yes.
And
yeah.
we're gonna dive into that as well. But first, let's talk about breath work. What is breath work?
There is so many programs out there that encompass breath work. This is not a new thing. It's, centuries old. The breath work that I'm trained in is called Butayko breathing, and it's considered functional breathing. And what its main focus is paying attention to the biochemical parts of breathing. So what that means is our gases, the nitric oxide, the CO2 in our body, and the oxygen. And often when we are breathing out of our mouth, we are eliminating carbon dioxide from our bloodstream too quickly. When that happens, we don't harness the benefits of that. So the functional breathing helps to gather the benefits of the CO2 so that you can get better circulation of your blood, better oxygen delivery to all parts of your body, your brain. It's really important too for people who have cold hands, cold feet. We're improving circulation. We're getting that oxygen to where it needs to go. And it's improving the nasal function. It's improving cognitive function, sleep. I decided to put together the performance and recovery program because there's so much focus on there's lots of focus on appropriately, like children and adults with myofunctional disorders. I'm not an athlete. You can tell by looking at me, right? I am not an athlete, but this program is not about physical training, or it's about the recovery part. And everything that has to do with breath work and sleep is absolutely crucial to recovery. And who needs recovery better than an athlete who is training hard all day long, 10, 12 hours a day, really going hard? You need lots of sleep, and you need lots of recovery and lots of breath work. The breath work leads to the sleep, and the sleep leads to the recovery, and the recovery leads to the increased performance and endurance.
So that's extremely important, especially like you said, athletes, anyone who works out, throughout the week. If you're not recovering properly, it's going to affect your overall performance. You know what I mean? Mm-hmm. So that's important. So let's talk some more about the breathing, because again, we talk about breathing in through the nose, out through the mouth. Now, when you're exercising, sometimes, you don't have a lot of oxygen, and most of us tend to breathe in through our mouths, because we feel that that's the most natural way to do it. But you're saying even if when you're exercising, you should breathe in through your nose and out through your mouth, right? Out through your nose, I'm sorry, right?
Ideally, yes. That is something that not many people can just do, especially if you're an intense athlete and in small bursts of really intense cardio, you're going to have to open your mouth. Like there's no way around it, you know, but you want to try to train yourself to open that mouth as little as possible. So when someone is going through like something like a program, you know, we start with small steps because your body has to start getting used to that breathing change. You have to get used to that CO2 gas building up. And that is really the ticket to improving just life, not just recovery in sports, but recovery in life, and just getting a good night's sleep and recovering from stress from work or whatever the situation is. But you have to start small and you have to get used to that incremental buildup of that CO2. Once you start to get to that point, then that's when you implement it into your training and you start maybe doing some light jogging, let's say with your lips closed. And then when you get to the point where you just can't tolerate, like I need a bigger breath, then you maybe just slow your pace a little bit. So instead of opening the mouth to get a big gasp of air, try to slow the pace down a little bit and let yourself get used to the breathing that way, and then ramp up again. So it takes a lot of practice. It's not something that you could just go out and do. You have to work up to it. Yeah.
This is great. This is great. Now I realize, because I'm thinking, I'll just tell people, just breathing through your nose, out through your nose, and they'll be able to do it and they'll thank me for it later. It takes a while to build up to that level, right?
Yeah, and you can learn, you know, there's lots of things you can find online. There's resources you can find on how to train yourself to do this. It's nice if you have someone that you can work with, like a coach, someone like myself, but
Right.
you can find these resources online. And you have to, especially if you're someone who does not have any like fitness training, you are not a exercising person. Yeah, you're not going to just go out and start running and like keep your lips closed. But
Right.
somebody who's really, you know, already trained may be able to start implementing some of those lip closure and breathing techniques a little bit more readily. But yeah, don't expect perfect results just starting for the first time. You have to build up to it.
Nice, nice. And I guess that's where a coach comes into play, you know, and that's what you guys pretty much are, coaches, well, therapists, but pretty much like being a trainer, correct?
Yeah, so the myofunctional therapist, the myo means muscle, functional. So we work on the muscle function around the head, the neck, and the tongue, the face. All of this musculature has to coordinate well in order to have good breathing. And then that plays into sleep as well. So I have some of the breath work training, and so do a lot of myofunctional therapists. I'm not alone in that category.
Right.
And I also have some sleep coaching training too. So I like to take the myofunctional therapy, the breath work training, the functional breathing, and the sleep coaching, and I wrapped it into this little package, which is what you're talking about with my sleep or performance and recovery, because you're taking components of all three disciplines and really being able to individualize it to the person and what their lifestyle is. So what are the sleep problems? What are the myofunctional problems? What are the breathing problems? And it's, just putting them together into a more bite-sized program that's easier for people to follow.
And you mentioned sleep. How do you train someone who was a mouth breather? They may be snoring, may wake up with dry mouth with their mouth open. How do you train someone to sleep with their mouth closed and to breathe through their nose when they're sleeping? Is there a way to train them to do that?
Yes, there is. And again, it takes practice, just like everything else. The first thing we have to do is make sure the nose works well, right? So sometimes we have to look at allergies and maybe seeing a doctor to make sure there's no problems in the nose. I know Chris talked about that as well, having an ENT or an ear, nose, and throat evaluation.
Right.
Make sure there's nothing in the way that's blocking the nose. In my case, as the kid with the allergies and the whole lifetime of inflammation, I shouldn't say little, but the bones inside the nose just over a lifetime got really humongous. And you can't make bone shrink. So even if I were to use the saline sprays every day and I did everything, and the allergy pills and everything, I can't make that bone shrink. So for me, the only way I was going to be able to breathe through my nose and to stop these sinus infections. I mean, at one point I took antibiotics for like 6 months in a row because my sinuses just could not drain. There was so much inflammation. So I
Wow.
had to have surgery in that case. But sometimes you have to make sure that there's nothing blocking it. And if there is, you have to address that first. And then you have to learn, where is the tongue? It has to be in the right position. It has to be up against the roof of the mouth so that it's not falling into the throat when you're sleeping. But one of the biggest things that we're looking at is there a tongue tie? Okay.
Mhm.
And I don't know, are you familiar with that word, tongue tie?
I'm familiar with it. I don't know what it means, but in my research, I ran across the phrase. And that's what we want to talk about next, the tongue. Go ahead.
All right. Yeah. The tongue is like pretty much the biggest component in all of this. We look at the tongue and we don't really, it's just kind of this big blob in our mouth, right? But it's actually 16 muscles. The tongue is made up of 8 pairs of muscles. Yeah.
16 muscles?
Yes. Yes.
Tongue?
Yes.
I'm
Mhm.
writing that down. 16 muscles. I
Yes.
believe in working out muscles, but the tongue has muscles of 16 muscles in the tongue. Go ahead.
In some professionals, some doctors will argue, well, what's the strongest muscle in the body? Is it the heart or is it the tongue? Because when you think about the heart, yes, it's vital. You need it for life, right? It
Right.
pumps, it does the same action all day long. But the tongue, based on its size and its complexity and the fact that it never stops moving, even when you're sleeping, there's a real strong argument. Some are going to say, nope, it's not the heart, it's the tongue that's the strongest
Really?
muscle, or in this case, muscles, because there are 16 muscles.
What? And
Not
the
big of
tongue never stops moving even when you're sleeping?
Never. It never stops moving. It's
Oh
always
my.
contracting. It's always filling the volume of, changing shape inside your mouth. And that's where sometimes, with sleep disordered breathing or sleep apnea, if the tongue is losing its strength, or the back of the throat, or even the soft palate where the little hangy ball is in the back,
Yeah.
if that starts to lose tone and strength as we get older, people might start, like choking on saliva or like choking on their water a little bit more than they ever used to. And maybe they start snoring more. These are, this isn't the only reason for sleep apnea, but those muscles lose their strength and tone as we go through life. And if the tongue has been tied the whole entire life, those muscles are very weak, and then those functions start to suffer, and it starts to come through as those difficulties with swallowing and sleeping. So in the myofunctional therapy, in the airway world, we are looking at what's called a posterior tongue tie. So you've probably seen like the baby that has the string right on the tip of their tongue, and their tongue is just literally on the floor of the mouth. They can't move it. That's a different kind of tongue tie than what we're assessing. We're looking at further back on the tongue, and that function, or that restriction, is what prevents the back part of the tongue from being able to move properly. So in order to have all these good functions, the back of the tongue needs to be able to completely like lift up and seal against the roof of the mouth. And if it can't, then you're changing like the pressure inside the mouth, and then the tongue is just not strong, and then it just kind of snowballs into all these problems. So we want to make sure you don't have a tongue tie that is preventing a posterior tongue tie, that is preventing the back part of the tongue from working.
Wow. All right. I'm very much intrigued about the tongue. Okay. And I want to go back and talk some more about this. I believe I'm intrigued about it. I'm sure others will be as well. So you're saying that our tongue, when you're not talking, when you're not eating, when you're not drinking, where should your tongue be?
The tongue should be, so if you take the tip of your tongue and you just like rub the top of your mouth behind your front teeth a little bit,
Mm-hmm.
and you feel those little lumps and bumps up there,
Yes.
the tip of your tongue should be about in that area. We call that the spot. And then the rest of your tongue should kind of like lift up and just like gently lift and seal against the roof of the mouth. So imagine like you're going to do a tongue click, and then you just suction your tongue and you hold it up there. Okay, now I'm open really big. So at normal rest, you're not going to be open like that. But in order to kind of get the tongue up, pretend like you're going to click your tongue and then you hold your tongue up and then you just close down.
I'm trying that as you speak.
Yeah, and let your tongue stay up there. Now, does it stay or does it want to fall down?
I know from learning from the interviews I have with Carice and with you, I'm noticing my tongue likes to lay down. You know what I'm saying? So I had to make a conscious effort to make sure it stays up. But you're saying it should stay up anytime you're not using it, it should be up.
Yep. The tongue should be up, the lips should be closed, and your teeth should be just far enough apart where you could almost slide a piece of paper through them. The teeth shouldn't be touching all the time either when you're not talking or when you're not chewing. So we call that the normal oral rest posture. Tongue up, lips closed, teeth are just a millimeter or two apart, and they're not touching all day long. We have ways and tricks to try to get that tongue to start learning how to be up there. That's part of our myofunctional therapy. That's one of the goals, is that the tongue lives upstairs.
So what are some of the health issues you see from people whose tongue basically is not in the proper place most of the time?
Oh my goodness, the list is so long.
Give me a few.
Well, sleep, for one, is a big one, and that's a big interest of mine because not only have I had the allergy problems my whole life, but I've been on a CPAP machine for 12 years. So I have sleep apnea, and that was diagnosed when I was 28. So sleep is a big one with the improper tongue function and improper nasal function. Anxiety disorders, ADHD, behavioral disorders, a lot of times is misdiagnosed, maybe like a sleep problem or an oral function problem is being diagnosed with as like a behavioral or a neurological problem. So it's really a great idea anytime like a child, there's a suspicion of ADHD or anything like that, to have maybe a sleep study to rule out that this child is not actually having sleep disordered breathing all night long. So sleep, ADHD, gosh, there's so many things. Of course, now I'm gonna TMJ.
What is TMJ? Because I didn't run across that.
So TMJ stands for temporal mandibular joints, but the actual disorders that are associated with that are called TMDs, temporal mandibular disorders. And especially with someone who has their mouth open, if you are like a mouth breather, we call it, or the mouth is open all the time, what happens is you are putting excessive elongated pressure on these big muscles up in your head called the temporalis, like a big seashell shaped muscle. And that's the biggest muscle that supports your joint, your TMJ joint, that allows you open and close your jaw. This jaw is the only bone in your whole skull that actually moves. Everything else stays still. So everything you do with your face, this jaw is moving and this joint is being engaged and activated. If you're like a mouth breather and you've been having your mouth open your whole life, you're elongating these muscles and they lose some of their tone. Then if we're chewing incorrectly, so if the tongue isn't able to manage food very well within the mouth, within the oral cavity, that, we all have like one side of the mouth that we tend to like to chew on most often.
Yes.
Yeah. That imbalance can start to change some of the jaw positioning, and we can see like, clenching and grinding in the TMJ problems. So whenever there's like a TMJ concern, it's always a good idea to really have that evaluated with a specialist, because it's a very complicated joint. But oftentimes people find relief by working on the muscles, and there's 4 main muscles that support that joint. Working on those muscles, just like you would work on the muscles around your knee if you had a bad knee.
Right.
To support the joint. So those are probably the 3 biggest that I can think of, like right off the top of my head, and there's so many.
Do you think also it could affect your respiratory system?
Yes, thank you. Asthma, COPD,
yes.
post-COVID.
Why is that? Why is that the case?
So most of us tend to breathe from our upper chest instead of using our diaphragm. Yeah, the diaphragm is a huge muscle. Not only is it really needed for breathing and quality of breathing, but it's supports a good part of your spine as well. Your spine is kind of connected and anchored to that. So it's really important. So we tend to breathe more up here instead of through our diaphragm. When the mouth is open, we're not getting as much resistance to that diaphragmatic muscle. So if you think about yourself, like when you breathe in through your nose and you try to expand your ribs out to the side a little bit, you can feel more movement. But if you breathe through your mouth, you don't have as much resistance and you don't have as much breathing or as much movement in your ribs and in your diaphragm. The asthma and other breathing disorders, they're inflammatory disorders, they're inflammatory problems. So we overbreathe, we breathe in too much air, just like we eat too much food. So metabolically and physiologically, we breathe in way more air than we actually need, just like we eat more than we need, metabolically. So that plays a role, and it kind of is always kicking us into this inflammatory process because we never allow those gases to balance to help with like overall function.
So that's very, very, very interesting. Because I know a lot of people with respiratory issues like asthma, COPD, and it's something because they may take medication and they still suffer with the illness. But what if you start looking at their breathing? That may actually may not be the root cause, but it could be part of the problem, right?
Yeah.
So, yeah, right. That's what I'm hearing.
Yeah. So like the Butayko breathing method that I have training in there's a lot of talk about asthma. And like I said before, asthma is like an inflammation. It's an inflammatory disease.
Right.
When we can slow down the breathing, we breathe through the nose, we're allowing those gases to balance. You're allowing that CO2 to build up. What CO2 does, carbon dioxide, is most people think of that as a waste, like it's a metabolic waste, and it is. But it's also very well known that we need to have a certain amount, and don't ask me the number because it's super complicated, but we need to have a certain amount of CO2 in our bloodstream. And what the CO2 does is it dilates or it opens all of the blood vessels in our entire body, in our whole digestive system as well, from our mouth all the way through. So you're allowing the body to use its own abilities to open up the circulatory system and open up the digestive system. You're also utilizing this nitric oxide you guys talked about that's created in the nose. And that is antibacterial, it's antiviral. There's like fungal components to it. It's the first line defense. And if you're breathing through your nose or your mouth all the time, you're not allowing your nose to filter out those things. You're not allowing that antimicrobial benefit of that gas to reduce some of the viral and bacterial load. And it gets into the lungs, and we just have the overbreathing is a lot of the problem that comes with asthma. Is just we're taking in too much air and we're not getting enough CO2 to help balance the system.
That is amazing. I understand that. And to me, it makes a lot of sense, especially when we talk about nitric oxide, how it's a vasodilator, right?
Yes.
And that is something that we need more of. And a lot of us, I would imagine, are not getting the nitric oxide that we need because it also helps your immune system, right? So it's amazing to me. And a lot of this has to do with proper breathing. And again, most of us are not getting it, not doing it. But now, again, with the tongue, you said the tongue has 16 muscles. So I'm thinking about getting some dumbbells and to put it on my tongue, but I'm just like, how do you strengthen the tongue?
Oh, we've got so many things. It just so happens because I work here all the time at my desk. I've got a humongous bag here full of different tools.
Really?
That we use we have all kinds of stuff. We have little ball whistles. We have syringes, all kinds of things like little squishy tubes. We do lots of things to help strengthen the tongue. And you can do it a lot on your own without tools. It's, resistance. Like, in your world, right? In order for a muscle contraction and muscle strength to happen, you have to have tone, right? It's the
Yeah.
same thing with the tongue. We have to start with getting it moving in different directions, up, down, side to side, forward, backward. And then after we get it moving, we have to create tone. And then you create tone, and then you start adding in the resistance exercises.
Really?
Yeah.
You're a trainer, like I
Exactly.
said.
Exactly.
That is amazing. Again, and you feel that most of us are not using our tongue correctly.
I'm pretty much sure that like hardly anybody does, and myself included, until I got into this world.
Yes.
And then once you start learning these things like yourself, you just have more questions like, whoa, and you get down that rabbit hole and you just want more.
Exactly.
It's all connected.
Exactly. Because I know when it comes to fitness, I'm like, okay, you got to exercise. You got to eat healthy. But how many people are talking about you've got to breathe right? Now, that is the missing link.
It is.
It truly is the missing link. I mean, we're not thinking about that, you know? And so
it's a biological process that we make it happen. We're going to survive. The body's going to survive. It's going to adapt. It's going to compensate. It's going to do what it needs to do to stay alive. But that doesn't always mean that the way it's doing it is helpful.
Right.
Yeah. So then that's what we try to work on, is getting it back to helpful function. And it's not just going to affect your face. It's going to affect your whole body.
Your whole body. Yeah, because I know you focus on the face. You focus on everything from, from your eyes down to your neck? What is that? What's that range?
Yeah, so those are like the muscles we work on. They kind of go from here to here.
Right, but it affects your whole body. I mean,
think of it this way. Do you know about fascial tissue and how it connects around muscles?
I heard of it.
Yeah. So to get back to the tongue for a moment, if we're looking at a tongue that has that posterior restriction, and we can't get that tongue up, and we can't seal, and we can't breathe well, and our mouth is open, and we say as the myofunctional therapist, we're like, you fall into, a 3 out of a 4 on the category of a tongue tie. There's different categories that we could place you in based on function and appearance and range of motion and all these things. The posterior tongue tie is connected to the floor of the mouth by fascial tissue. So fascial tissue, if you think of like a raw chicken breast and you've got that really thin, like white layer, not like those ligaments that go through it, but that layer, that's fascial tissue. And that wraps and interconnects between every single muscle in our entire body, There's 3 lines of fascia. The first line goes down the front. It starts under your tongue and goes all the way to your toes. So if someone is really restricted in their tongue, sometimes they have what's called a functional frenuloplasty, where the doctor, the dentist, the airway trained dentist will basically disorganize the fascial tissue that's underneath those tongue muscles, or around those tongue muscles underneath. That can sometimes give people improvement in breathing, because think of it as a chain. If you have a kink in the first chain of the length of the chain, that kink is going to pull. You're going to have forward head posture. You're going to start opening your mouth. It's going to start affecting your shoulders or rolling forward. Maybe you can't expand your diaphragm all the way. And I've had so many people tell me that even their plantar fasciitis improved once they had their tongue tie released, because they're releasing that fascial tension that's starting underneath the tongue, and then the effects of that trickle all the way down to our feet.
Whoa, really? We're so connected.
Everything, the whole body is connected.
It's connected. That is amazing.
And
this is really great. This is good information.
Yeah. And I mean, when you take it all and you put it together, you look at the muscles of the face, the tongue, the neck, and then you think about the breathing, and then you think about the sleeping, and just how they're all needed to really just bring function and like restoration, and trying to bring things back into homeostasis, just that good balance of
balance.
Balance. That's what it is. It's balance.
Thank you. And it's very interesting to me, because again, my talk with Carice, we talked about how nasal breathing also helps to regulate your blood pressure.
Yeah.
You know? Now, the first thing you're going to get when you go to a doctor and he says you have high blood pressure, he's going to give you a pill, right? He's going to expect you to be on it for the rest of your life. But what if you said, well, wait a minute, doc, let me change my breathing. Let me make sure I'm nasal breathing before I decide to take that medication. No, you're not going to hear that from the doctors, but I think we need to talk more about that.
Yeah.
You know? How
And
many?
this isn't us just talking about it. I mean, this is patient experiences, you know?
Yes. Oh, yes. Yes.
Everything from the tongue to the breathing to the sleep to chronic pain disorders, fibromyalgia, menopause.
Fibromyalgia as well.
Yeah, like all those like autoimmune diseases. We can get so much pain control and relief with good breathing because you're allowing that oxygen to get to more parts of the body. It's not about oxygen saturation. So if you were to check your oxygen on your finger,
right,
it's not about that, because you're going to have the same oxygen saturation, but how is it jumping off those red blood cells and getting to the body parts it needs to get to?
yes.
So this breathing technique is so effective for chronic pain, migraines, menstrual, perimenopausal and menopausal women, asthma we talked about. There's just so many things.
Yes.
Migraines,
Yes.
everything.
Because my understanding when it comes to nutrition, you eat fruits and vegetables. Fruits and vegetables are alkaline. They have more oxygen in them, right? And that's one of the benefits for your cells. So imagine now you're saying, okay, not only will I eat healthier, I'm going to start breathing in through my nose with that nitric oxide, breathing out through my nose, and I'm going to allow more oxygen to flood my cells, which to me says you're going to end up becoming more healthy.
Exactly.
You know? And that's what I want people to take away from this. You're talking about improving your health, okay, naturally, allowing your body to heal itself like it was supposed to do. But I always say you have to give it what it needs. Your body needs oxygen. And a lot of us are not giving it enough oxygen. So the body becomes acidic and we get sick.
Yes.
Absolutely amazing. Now you have an 8-week program, right? And I'm going to put it up so people can see it. But talk about that.
So I put this together to focus on athletes because, like I said, this can be beneficial for like every population of person. But this particular program is geared towards athletes because I know some athletes and I know some military people, and they want to have, if you're a really like high training athlete and you have high athletic goals and you just need or want to get to the next level, this sometimes is the difference that gets you there. Because it's not just about, so the breath work, we talked about so much already about the benefits of that, what it's doing to the body. Yes. When you get more oxygen to your muscles, you perform better. You don't have as much fatigue, right?
Right.
When you can breathe well out of your nose and your lungs can expand and your diaphragm can expand and you can breathe better, you're going to perform better. But the breath work is really the part, it's cumulative. So this isn't something that you just do once or twice and you're like, oh, I'm amazing. The breath work is cumulative. So it's something you have to kind of stick with. Okay. The more you do it, the more benefits you get, the faster you get them. Then that starts to lead into the sleep improvements. So an athlete who's training all day, like an Olympic athlete or professional athletes, basketball players, you can find quotes on the internet from Tom Brady and LeBron James and the other like really big names that everyone knows, that they push themselves to the limit and they need to recover. And what is recovery? That's the sleep. So they may sleep 10, 12, 13 hours because their body needs to recover that much from how much they put themselves through physically during their training. So then the tongue, so the other part of that flyer is the tongue, and that is just trying to, first of all, I want to make sure you don't have a posterior tongue tie. That's the first thing I'm going to look at, and we might talk about that, but I want you to know where your tongue should be, how to get it there, and then you take all three of those components and you start to see improvements pretty darn quickly. When I started the breath work for myself, I was chronic insomnia. Like I said, I've had sleep apnea for 12 years. I'm on a CPAP machine. when I did the breath work, I probably had the best night of sleep I've ever had in my entire life after 3 nights. And
Really?
it was like life-changing.
Really? Well, unbelievable. How
It's
often do
amazing.
you recommend doing breath work? I mean, every day?
Multiple times a day. Mhm.
Multiple? For what length of time?
In the most ideal situation,
Mhm.
we would be doing breath work like 6 times a day, but I know that that's not realistic
Kind of
for
hard for a
most
lot of
people.
people.
Yeah, because you're talking about 10 minutes at a
Each time.
time, and most people cannot do that. So sometimes it might take a little bit longer, but it's more realistic for someone to be able to do like a good breath work training 3 or 4 times a day. And even that is still a lot. But you do it in small, bursts throughout the day, you're still going to get that accumulation, that accumulative benefit.
Right.
It just might be over a little bit of a longer period of time than if you were doing it as the prescribed 6 times a day.
But you still you still reap the rewards, you still get the benefits.
Mm-hmm.
Right?
Yeah.
That's important. And because I know for a fact, even just doing meditation, deeply inhaling, exhaling, it makes a difference,
Mm-hmm.
as well. But imagine doing the breath work like you're talking about 4 or 5 times a day.
Yeah.
And that's amazing because you see the results. You get the results, right?
Pretty quickly too. Pretty quickly.
And pretty quickly.
But then you have to keep doing it to get the benefit. Just like with any other training or any other therapy, you have to keep working on it to keep getting the benefits of it.
Okay, and this is your program, and you said it's mainly geared towards athletes.
This one in particular, yeah. But I can adapt it to pretty much any group of person and make it individualized to them. So no person's the same. So just because this is a program doesn't mean you're going to get the same exact thing as your neighbor, as your coworker. Everybody is so different. And so I probably spend most of my time as a myofunctional therapist treatment planning because each individual has their own set of needs. And that's what I plan everything out for is you. There's no cookie cutter here. You're not going to get the same thing as the person next to you.
Well, I feel the same way when it comes to fitness. It's no cookie cutter approach. Everyone is different.
Right.
What may work for you may not work for somebody else, right?
Exactly. Mm-hmm.
Well, this is great. Now, where is your business, your practice? Where is it located for my viewers?
So I'm in Wisconsin. I'm in Sheboygan, Wisconsin, in the Midwest. But every single thing that I do can also be done virtually.
Nice, nice.
Yeah.
So you can see someone like you see me and diagnose, treat, recommend, whatever you need to do virtually.
Yep, every single thing. And we have ways of doing that. We send each other pictures and we do things. And I know that the therapy is working based on what you described to me. So I know about those muscles. I know what they should be doing. I know what they should feel like. And if you're explaining to me what you're feeling, or I'm watching you and I'm seeing things moving in places that they shouldn't be moving, I know something's not quite right. So a lot of this is based on what you described to me. That's how I know that you're getting the benefit for that muscular activity that we're working on. We don't need hands-on approach for anything. It's nice if someone's local, and you can be in person, but every single thing we do and almost every myofunctional therapy therapist has some sort of virtual component to their practice. It's very common.
Wow. Was that more brought on since the pandemic?
Yeah.
Right? So a lot of good came out of it. I mean, when it comes to, helping people.
It really did.
I look at it like that. I have a 6-week fitness program that I do virtually, with adults all over the country. And we couldn't have done that, prior to the pandemic. We wouldn't have thought about that. But now, you got to get fit one way or the other. You can do it virtually. You can do it at home, or out the street, whatever. As long as you make the time and you have the commitment, because it takes commitment to do it.
It does.
You've got to believe in yourself and believe that you're worth it. You are worthy of it. Yes. Anything else you'd like to share, Becca?
I think you just said it perfectly. We can see people all over the world. We can help lots of people, and we can make it happen in ways that no one ever thought possible before. And yes, you have to invest in yourself, because the investments you make now are going to pay themselves tenfold as you continue to get older.
Yes. And your health is truly your wealth.
It truly is.
It
Yep.
truly is. And I tell people you can't put a price on your health.
Right.
You know what I mean? Whatever
Yes.
it takes, you've got to invest in it because you only get one body. You take care of it, it'll take care of you. So Becca Rose, on behalf of Body Scope of New York, that's my nonprofit and 6 Weeks of Fitness, I want to thank you for coming on my show today.
Thank you so much. It was an honor.
You were great. And I truly hope this program was informative, encouraging, and inspiring to my listeners and viewers, that they will continue tuning in to my 6 Weeks of Fitness podcast. If you have any questions, comments, or suggestions for the show, please leave them in the comment section below. And don't forget to subscribe so you don't miss any future episodes. And remember, we don't stop exercising because we grow old. We grow old because we stop exercising. Right, Becca?
Very good. Perfect.